Nursing Programs for Kaplan, and welcome to this discussion of safe and effective care environment. We're going to be talking about this topic, and it's divided into two sections. The first one is management of care, and the second is safety and infection control. Let's talk for a minute about management of care. Management of care comprises about 7 to 13% of the questions you'll see on your NCLEX exam. And when you're dealing with management of care, you need to consider the philosophy of healthcare in the United States today in order to correctly answer questions. And healthcare in the U.S. is really focused on three different areas. The first is health promotion, the second is the concept of wellness, and third is illness prevention. And when you're talking about prevention, there are three levels of prevention. The first is what we call primary prevention, and this is really true prevention. What you're looking at or for is actions that prevent or delay the occurrence of an illness. A good example would be eating well-balanced meals, maintaining a good weight, participating in a regular exercise program, refraining from smoking, children getting immunizations, wearing seatbelts. Again, all the safety issues and prevention issues that you take place or you engage in every day. The second level of prevention is what they consider secondary prevention. This type of prevention is the early detection of a disease or a condition, and clients are either experiencing health problems already or at high risk for developing certain problems. Good examples of secondary prevention would be the yearly pap smear that women of childbearing ages should have, TB screening using the Tyne test, blood pressure screening for adults, or the yearly mammograms, again, for women. The third level of prevention is what we call tertiary prevention, and in this case there is already a permanent disease, defect, or disability, and the idea is to try and minimize the effects of it and help the client have optional functioning. And a good example of this would be rehabilitation after a cerebrovascular accident. So again, health in the United States is focused on health promotion, wellness, and illness prevention. And as you go through the questions on the exam and as you prepare and review content, you want to make sure that you know what the responsibility of the nurse is. And nurses in the U.S. are responsible for first predicting potential problems, that is being aware of what could happen, hopefully preventing the problem from occurring, and then helping to manage problems that do occur. So again, the goal of the nurse is to predict, to prevent, and to manage. So let's talk about the professional nurse. The professional nurse has specific knowledge and skills. This is, you have gone to nursing school and you've learned a lot of information and you have knowledge and abilities that you can share with your clients. The second component of a professional nurse is the fact that the nurse is person-centered. It's not about me, it's about the patient and the clients that you deal with. A third component of a professional nurse is the fact that the nurse can form and does function in an autonomous way. The nurse is independent and able to make competent decisions. Gone are the days when the nurse had to stand up when the physician came in the room. Nurses are no longer considered handmaidens of the physician. There are independent nursing activities that the nurse can and should do. Another concept of a professional nurse is accountability. The nurse is responsible for the care given, and nursing practice is governed by standards of care. It's governed by nurse practice acts. Each state has a particular practice act that governs what should and should not be done to care for patients in that particular states. So when you're dealing with or thinking about professional nursing, there are three components. The first is care, the second is cure, and the third is coordination, where the nurse works as part of an interdisciplinary team to provide for care for patients. Let's talk about the nurse-client relationship or nurse-patient relationship. This relationship has certain characteristics. The first is that it is a helping, caring relationship. And again, this relationship is different than a peer relationship or a relationship with your children or a relationship with your parents. So again, there's a helping relationship. The nurse offers information and provides information to clients and patients. The nurse helps clients and patients make decisions and improve their health and prevent illness. Again, the nurse works with the client to hopefully change behaviors in a very positive way. Another characteristic of the nurse-client relationship is that the nurse and client work together as a team. It's not the nurse telling the client what to do. It's not the nurse giving advice. If I were you, I would. It really is a team effort, and the more you involve the patient in decisions about their care, the more compliant the patient will be, the more in control of their life they will be, and the more likely they will be to go along with what will be healthy for them. Another characteristic of the nurse-client relationship is the fact that it's the nurse's responsibility to act as the client's advocate. That means to speak for the client, and we'll talk a little bit more about this in a minute. And the last thing about a nurse-client relationship is that it is a protected relationship. There are certain characteristics, and one of the chief ones that I will refer to several times in this tape is the fact that there's confidentiality involved in a nurse-client relationship. Information that's shared between the patient and the client is kept confidential. Chart information is kept confidential. So you need, as a nurse, to be very aware of where you talk about patient information. If you're in the hall or if you're in the cafeteria, you need to be careful about who you talk with patient information about or who you're with and what responsibility they have toward the patient. So it's a very collaborative relationship. So the nurse collaborates with the client and the family, and the nurse collaborates with other members of the interdisciplinary team. And that requires communication. And let's talk about communication. Communication is one of the underlying themes for the NCLEX exam, and there are two types of communication. The first is verbal, and that's very easy to understand. That's either what you say, I'm participating in verbal communication with you now, or the written word, or both forms of verbal communication. And that's very upfront, and you know what it is you're dealing with. The second form of communication is what we call nonverbal communication. And the thing to remember about nonverbal communication is that it is culturally driven. Certain cultures have different rules, if you will, about what is accepted and non-accepted for nonverbal communication. And when you're talking about nonverbal communication, it's how you communicate a message without using words, or either written or spoken. It's body language. It's personal appearance. It's posture. You know, I would give you a very different picture if I were all slumped over and, you know, versus standing erect and engaging with you as I talked with you. Facial expressions have a lot to do with nonverbal communication. Eye contact, you know, whether we make eye contact as I talk with you versus I'm talking with you and I'm looking away. Gestures you make. Some people, like me, talk with their hands. Other people, they don't engage in that. And one of the other concerns or issues with nonverbal communication is personal space, how close you get to the people as you talk with them. And again, important for you to remember that nonverbal communication is culturally driven. There is such a thing as professional communication. Again, the way you communicate with your patients and clients and the way you communicate with members of the interdisciplinary team is different than the way you talk with your spouse or your children or your parents or siblings. Again, it should be courteous, not that you don't talk courteously to everyone, but again, you use names when you're talking with patients and clients. It's not the patient in room 203 or the gallbladder patient or that type of thing. It needs to be on a more personal level where you actually use the patient's name. Again, privacy and confidentiality when you're communicating with and about patients needs to be paramount. Again, the professional communication needs to be trustworthy. You need to be able to be trusted with very highly sensitive and information that is highly confidential. And again, the nurse or the professional communication that the nurse engages in should be assertive. Now, there's a difference between assertive and aggressive. An assertive person, again, if I'm acting as your advocate, I will be assertive with what I do, and I will work with you and for you. Aggressive is a very much in-your-face, very confrontational type of behavior, and that doesn't fall under the realm of professional communication. Let's change topics a little bit here, and we're going to talk about the Patient Bill of Rights. The Patient Bill of Rights, if you've been in a healthcare setting anytime recently, and I'm sure you have, you've seen this most of the times it's posted on the wall. There are rights that patients have or clients have, and let's talk about some of those, because it is the nurse's responsibility to uphold the patient's rights. The first right is privacy and confidentiality, and we talked a little bit about that. Unless the client consents, the nurse is unable to share confidential information with anyone other than those actively involved in the care. So again, be very careful where you discuss the patient. If you're sitting in the hospital cafeteria and talking about Mr. Jones and the fact that his HIV status came back and he's positive, and you're overheard by other people, you have broken confidentiality. And again, there may be questions on the NCLEX exam dealing with this, where you're given a situation where the nurse does something, and you have to be able to recognize the fact that that nurse broke confidentiality in discussing the care of a patient or a patient's status, for example, with the housekeeping team, or someone who happened to be in the room and said, "How's Mr. Smith doing?" And the nurse gives chapter and verse about how Mr. Smith is really doing. That's breaking confidentiality. That's inappropriate. So again, you can't divulge confidential information without patient consent. Another issue is that the patients have a right for respectful care, to respect the rights of the individual and not do anything that would be deleterious to that person. And the client has a right to current information, to know what's going on and when and how. Again, the more a patient can participate in their care, the better they'll be able to actively improve their health status and prevent injury and disease.